Well aware of the physical harm that things like vaping and smoking can do to one's body, especially a young adult. Tell us about how vaping is actually harming the mental health of our teenagers.
No, good afternoon to you and the viewers. The difficulty with vaping is that when it was first brought in, it was advertised almost as if it is not cigarettes, almost as if it does not have nicotine. But it does have nicotine, and the difficulty is that if you look at one cigarette, it has about 1 to 2 milligrams of nicotine in one cigarette. But if you look at one vape, if we take a 5% vape, it would have somewhere between 50 milligrams to as high as 137 milligrams of nicotine. So what it means is that as much as there is a belief that there's less cancer-forming chemicals, there's actually very high nicotine. Now, why is nicotine problematic? Nicotine is problematic because it's a psychostimulant, meaning it stimulates the brain. So example is that cocaine is a stimulant, if I'm to give that example. But what it does is that it goes to stimulate the brain, and at the beginning, teens tend to believe that nicotine helps them cope with anxiety. But what it does is that when you're under stress, being chased by a lion, for example, when you're under stress at that time, you actually need your stress response to kick in so you can run. So what would happen is that when they are stressed, let's say academic stress, when they use a vape at that time, because it activates their stress response, they feel they are better. It actually does not help anxiety, it causes anxiety. Because the more you're in that stress response longer, the more now you develop anxiety.
It does become a bit of a cycle, doesn't it? It becomes a bit of a cycle where you kind of want to deal with your stress, but you're adding something that creates more of that stress. So that is, in terms of their actual brain development, Doc, just tell us, especially these are teenagers going through developmental and hormonal changes, how permanent can this damage be?
To tell you the truth, how permanent it is, we don't know. It's almost like we are going back to the 1940s with cigarettes.